Today we're going to talk about hormones from Chapter 8. As a review, what are hormones? Hormones are chemicals released into our bloodstream that maintain homeostasis. Examples of functions related to hormones are reproduction, growth, development, and metabolism. Each hormone has a specific function for a specific location in the body. And they also have synthetic hormones, which are used for replacement therapy used in medical settings, but sometimes are on our back tables during surgery. Hormones can be classified as steroid and non-steroid. So it's always important to understand which hormone you have and the specific function it will have on the patient. Please review the common terms and their definitions. And review the endocrine system anatomy. Next, we're going to look at the endocrine glands and their hormones. The pituitary gland, known as the master gland, plays a vital role in reproduction and growth, and it regulates the function of the renal system and our thyroid gland. The pituitary gland is connected to the hypothalamus by the infundibulum. The hypothalamus synthesizes or makes oxytocin, otherwise known as pitocin, and vasopressin. It is important to know what oxytocin is because it can stimulate uterine contractions. If one of our patients cannot produce oxytocin, we will induce labor by administering it through their IV. So if you were scrubbed in on a C-section and the surgeon wants to slow down postpartum bleeding, you may have oxytocin on your field, and the surgeon would then inject that into the uterus. Pitocin, or vasopressin, is a man-made antidiuretic used to treat abdominal enlargement after surgery. The thyroid and the parathyroid glands. First, the thyroid is a vascular structure which does have two lobes, right and left. It is the largest of the endocrine gland, and it sets the rate of body metabolism. In children, it can stunt growth, delay mental development, and in adults, it can slow metabolism. Our parathyroids are small, yellowish, brown ovals covered in adipose tissue. And we usually have 4 on each side of the thyroid gland, and they produce PTH, parathyroid hormone. The PTH controls the level of calcium in our blood. And calcium is essential for proper functioning of our nerves, muscles, and heart. If you have too high PTH level, it may mean you have hyperthyroidism, benign tumor of the parathyroid gland, kidney disease, or vitamin D deficiency. If your test shows you have too low of a PTH, it could mean you have hypothyroidism, or too much vitamin D or calcium. Next is the adrenal gland. The adrenal gland is located on top of our kidneys and is highly vascular. It has an outer portion called the cortex, and then the middle central portion called the medulla. The medulla produces, stores, and secretes the hormone epinephrine, or adrenaline, norepinephrine, or noradrenaline, and dopamine. All 3 are called catecholamines. Prepare our body for fight or flight. Now, epinephrine is used a lot in surgery, used in combination with our local on our field. For example, lidocaine with epinephrine 1 to 100,000. The vial is red when it has epinephrine in it, and we do use it locally, which causes vasoconstriction. Topical epinephrine, for example, 1 to 100, 1 to 1,000 means it is more concentrated and used in limited areas. And it is always applied topically, never injected, because that could be deadly and cause tachycardia or hypertension. Parenteral means medication being administered through the sub-Q, IM, or IV, where topical, again, is a cream or ointment or a solution applied to your skin. The cortex of the adrenal is classified into 2 major groups, glucocorticoids or mineral corticoids, our most significant being glucocorticoids, which used alone or combination to reduce or inhibit inflammation after procedures. We tend to use glucocorticoids in orthopedic procedures and ophthalmic procedures. The pancreas. The pancreas has two hormones and produces insulin and glucagon. They both regulate our metabolism of glucose, which is a simple sugar for energy. Glucagon is a protein that breaks down and increases our blood glucose levels. Insulin, also a protein, stimulates the liver to form glucogen from glucose, which lowers the blood glucose levels. There also is no direct OR use. Next is the ovarian gland, which produces estrogen and progesterone. It is critical to the development and maintenance of female sex characteristics. Estrogen, if removed, have HRT, hormone replacement therapy, which is used after menopause, vaginal hysterectomies, or for palliative care for cancer and sensitive tumors. Palliative care means we are relieving symptoms but not curing the condition. The testicular gland is produced male sex hormones called the androgens, and the primary testosterone are critical for male sex organs and secondary sex characteristics such as body hair, facial hair, enlarged larynx, or increased stature. Testosterone is used for replacement therapy as well, as seen in hypogonadism. Male hypogonadism, also known as testosterone deficiency, is a failure of the testes to produce the male sex hormone testosterone, sperm, or both. It can be due to a testicular disorder or the result of a disease process involving the hypothalamus and pituitary gland. It is also used to treat some types of breast cancer in women and endometriosis. And lastly, hormone information. Call out the drug and strength when handling to surgeon, and when you're unsure, always stop and get clarification. Always label your medications immediately after receiving them.